When I was working in a pediatric psychiatric setting, and a patient that I had become very close to deteriorated and had to be transferred to a very large inpatient facility. And I had to help transport her to this large state facility. And she was only 13 years old. She was a ward of the state. She didn't even know where her parents were, who her parents were. And she kind of adopted me and referred to me as Aunt Ann. It was in a residential setting. When she had to be hospitalized, I found myself probably over-involved and very, very emotional. I was able to hold it together during the whole admission process and everything, but in the van on the way back to the residential setting, just totally lost it and cried for hours about that.
Nurses are dealing with interpersonal relationships every day with their patients. They have expectations on them. They can blame them. They can exaggerate their attachment to them, and that actually can be really a big burden. Stress has very negative emotional, psychological, and physical consequences. And for example, people can really suffer burnout, which is extreme stress, which translates into people not even able to go to work. Their job is associated with a caring role, and they need to have some kind of emotional distance. And that doesn't make you cold, and that doesn't make you frivolous.
I found in particular that pediatrics was a field that was very difficult for me, especially after I had children. I over-identified, so I tended to stay away from sick children. Sick children who were going to get better were one thing, but when I was in school, I was in a large medical center, and the only children we had at the large medical center children's hospital were children who were very, very sick. And that was not someone coming in for a tonsillectomy, appendectomy, and going home. These were many times terminally ill children, and I found that very hard, just for me personally, to deal with.
They need to accept that every time that they encounter death, they will feel sad, acknowledge that emotion, and move on. Because if they don't move on, they cannot do the job, they cannot help other patients, and they cannot be healthy.
I think it's very difficult not to personalize it. I think in the 60s and 70s, nurses were expected to put on a face and be very prim and proper and not show any of their emotions. I think that's unrealistic, and I think now people are much more accepting of nurses crying with their patients. If their patient dies, their patient's very sick, patients cry, families cry, nurses cry, and that's okay. That's a more human experience.
They can actually express sadness to each other, one nurse to another. That kind of social sharing of the emotion can be very positive for their emotional life. And that is very positive for the nurse herself to be able to express sadness through crying if she genuinely feels sadness, because crying can have a very important cathartic effect. And also for the patient, because it shows very clearly through that expression that you are actually with the patient in his or her feelings, that you are with him or her, that you understand him or her. So I can imagine that that can have a positive effect up to a certain extent, because if you become too emotionally involved in your patient's emotional life, if you are too much there with them, if you are not able to put enough emotional distance, it is as if their pain is your pain always. So it is a burden on you. Death is part of everybody's life. So if you don't deal with it with balance and you don't try to cope with it well, then it can really lead to negative emotions such as guilt or shame or self-anger. And it is okay. Those emotions are very adapted and very positive. You feel them as we all feel those emotions. It's part of our emotional life. It can be very functional, very positive to feel those emotions so you do better next time. But if you constantly feel them, it's not healthy.
Maintaining comfort and maintaining a level of a pain management near end of life can be very rewarding. Death is inevitable if you can make that death a comfortable one, where the patient is not alone and they're not in pain, or they don't have other symptoms that are being problematic, like nausea, vomiting, that kind of thing. then you're doing a good job, and you can get a lot of satisfaction in that.
I think it's a beautiful profession because I think it allows you to combine knowledge, academic knowledge and professional knowledge with human relationship. And I think that combination is very powerful and is beautiful.